Then I think thank you all for joining. I don't know who's actually here, so I'm just going to start with brief introductions here, mainly focusing on NF Core because we also know that there's a couple of people who are not participating from within the NF Core community, but rather outside, some from LinkedIn, some people with more background in validation and quality topics. So that's why we would like to also emphasize a little bit what this is all about and what our intentions with that with this is. And then probably showcase a couple of slides where we actually explain a little bit why we are initiating this special interest group and who we are and what we think and envision in the future, what this could be about, and then opening up for discussions also. So we have prepared a small Slido so that people can also answer that maybe while we're starting with the intro session part, so that we get a better feeling of who's actually here, who's actually participating, who wants to participate, and what people are thinking. And then we will have also another colleague of mine taking over after the introductory slide part to talk about a little bit about the ideas and vision that we, coming from the pharmaceutical industry, had on this. But in the end, we can anyways catch up together also on various other aspects that people have potentially with this. So for those who are not familiar with it, NF Core is a community of people working jointly on Nextflow pipelines in a more broader sense, working on harmonizing them, making them usable. Making them usable. Okay, somebody else unmuted. Making them usable across different institutions, different providers, different academic, but also industry uses, which opens up an entire set of feasibilities. So for example, anybody who's writing an NF Core pipeline, who's writing a pipeline, pushing it to NF Core, follows the latest standards, can make that pipeline directly usable by others. So it could be very interesting for people, for example, from academia, for people from industry, to reuse and recycle as much as possible. That's the old description of NF Core. Nowadays, this has also become a large community of people working on harmonizing these type of pipelines, harmonizing standards, coming up with tests and everything. So setting basically the stage on how to do these type of large-scale data analysis pipelines, hopefully as good as possible. And the idea behind this special interest group that we are about to kickstart now today is to cover the topics around regulatory and validation affairs. And hopefully everybody here joining today is actually interested in this type of topics around pipeline validation and qualification for clinical applications, to working on NF Core pipelines, hopefully in the future, to make them better, improve them in a way so that they can actually be used for these clinical applications or even further, and be working on new guidelines and making these hopefully as complete as possible to ensure that everybody who's interested in making pipelines as good as possible with respect to regulatory aspects, to work on these guidelines and making these hopefully a success within the community. So that's the broad setting here. And I think my slides are a little bit frozen now. The agenda is something we're about to talk about is also how we're using open source bioinformatics pipelines for clinical applications within Boehringer Ingelheim at the moment. So Thomas will talk about that a little bit. And then we will hopefully have a couple of minutes where we can discuss this Slido that we are having open already for questions. So we have had a couple of questions that we would like to open up for the community so that everybody can participate there. And then we'll talk a bit about this participant survey at the end of the presentation. And then we open up largely to the discussion with the entire people who are joining today, because we also think that there's a lot of people interested in the topic, but nevertheless, people might have different ideas, might have different angles on the topic itself. And then a couple of minutes we should dedicate for having action items for the next meeting in the future. And also come up with a meeting schedule so that we have regular catch-up meetings within the special interest group regulatory in the future. And that's it for the beginning. So NF Core, for those who don't know yet, I mean, I briefly touched a couple of these things. It's the biggest open source bioinformatics Nextflow community nowadays. Thousands of people are actually working there, so we have quite nice communications. Nice communication platforms via GitHub and Slack, which are also open for everybody to share. There's also potentially the possibility to go via the Nextflow forum that is hosted by Sequera. If you just want to look at some of the latest information on the Nextflow and NF Core communities, you can also check out this nice bioRxiv preprint, which is pretty new. And apart from the paper that was coming out 7 years ago now, this was recently updated and should actually display quite in detail what NF Core is all about and what Nextflow is all about at the current stage. The NF Core regulatory group is today's kickoff. Today we're intending to kick this off, and I think some of the topics I already briefly tried to mention. Thomas will also talk about now in detail and will probably take over here at that point. Tom, do you want to chime in?
Yeah, so can everybody hear me?
Yes.
Perfect. So thank you, Alex, and very welcome to everyone. My name is Tom. I'm part of this regulatory special interest group, and I'm working clinical bioinformatics at Boehringer Ingelheim, and I have the pleasure to just briefly outline some of our efforts of validation in the open source community and the current status. So, Alex, you still have the control of the slides, so you can go. So at the moment, I will give you a brief overview. Boehringer's bioinformatic pipelines consist of NF Core pipelines, open source pipelines, as well as internally developed pipelines. And for the clinical bioinformatics, we actually, next please. Alex, can you press? Yeah. The goal is to validate bioinformatic pipelines for clinical use. Next. At the moment, and I think this problem, a lot of pharma companies and a lot of clinical providers and people working in clinical bioinformatics or around this we have all the same problem. Validation is a key bottleneck. It's resource and time intensive, and we would really like to work on the latest technology and the latest methods and the latest pipelines and up to date. So in this case, next please. The validation overall are two things. First of all, what does validation mean to us? First, it's all about reliability. To ensure that nothing breaks. And the second thing is correctness. So correctness, of course, scientific correctness is very important. And reliability is that the correctness is consistently, that we consistently have correct results. That's kind of an overview of validation. And how this is achieved, next please, is in general risk assessment. Risk assessments are consisting of tests, documentation, change management, and reviews. That means tests can be automated tests, but also can be audited tests where people perform manual tests. Documentation is very important. Change management, if something changes from version A to version B or 0.1 to 0.2, who does review those changes, who checks and how is checked that those changes do not break the reliability and the accuracy of the pipelines. And of course, reviews is the code reviewed for any scientific incorrectness and so on and so forth. Next, please. So we want to talk about validation of really bioinformatic pipelines. Some validation has multiple categories. One of them is computer systems validation. So basically validating the hardware or the operating systems you're running on your pipelines. Like you can run it local on HPC, on cloud, and so on. With the abstraction of Nextflow, NF Core, and containerization, we really want to focus on the code, library, software, and in general the pipelines, not on the computer systems. Next, please. So our vision, what we would like to have for this regulatory special interest group, we would like to push open source, validated open source bioinformatics pipelines, which would be accepted by regulatory authorities, and would be ready for internal decision making. That would be kind of vision. And how to do this? Next, please. So we, of course, the benefits are we increase quality and reproducibility. We speed up processes by pooling resources and joining forces. We strengthen the platform for future developments, and we give back to open source community and push the open source community. That's really important to us. Next, please. The roadmap, therefore, would be the first step would be align on standard requirements. So what is needed? That we have to find out what is needed to validate open source pipelines. Align and coordinate this with regulatory authorities. Then the next thing would be, next, Alex, to pool the resources and create a proof of concept. And we've discussed this just recently at the SECERA Nextflow meeting in Basel, that one of the best proof of concepts would be to take one of the most used and most popular open source pipelines. This would be NF Core, the RNA-seq, for example. Then, if we come through and if we are successful with this proof of concept, then we could identify who's using what pipelines, or who is interested in what pipelines. We could pool resources and apply the same process to those pipelines. Next, please. So the next steps, basically, to align on the standard requirements and regular authorities, and this would be kind of a starting point for discussion, would be collecting experiences with validating bioinformatics pipelines. This is why we are in this special interest group. We would like to share. Let's find out what we need, what are the experiences, and the requirements and guidelines for the different standards, what standards are out there, what standards are required. And then, next please, reach out to contacts to the regulatory authorities and to find out what is needed and if that's all right. And then actually perform this. But the first step is collect experience. And there, the discussion already started on Slack. So one of the communications channels for this regulatory special interest group is, for example, Slack. And there are other, and this is, Alex, you can click through the next slides, please, very quickly. If there is literature out there, this is where already there is different literature for how to validating bioinformatics pipelines. There's LinkedIn groups of validation. There are conferences just with this topic. There are networks. There are different schedules. There are notices and there are different platforms. Next, please, yeah. And there are publications, regulation guidelines. There are warning letters from FDA, for example, and so on. So there are many, many different guidelines and resources to discuss this. And we are looking forward to a fruitful discussion and nice collaboration. And therefore, I think Alex would take over with the actual poll now, right?
Yes, I think we can put up the poll again. I think
so. You have to click on the slide to activate, I think.
The first one, you think?
Yeah, no, here exactly. Yeah. Oh, it doesn't work. No. Okay. Then I'll try to open it. Give me a second.
Alex, maybe you could answer, there's a question that's popped up in the Q&A already. Someone asked, how long does it usually take to validate the pipeline?
So at the moment, we also do not have the full experience on that topic at the moment, honestly speaking. So it really depends. That's kind of the only answer you can give, I think, at the moment. It also depends on what's the applicable criteria that you have to apply to do that. If it's clinical diagnostics, companion diagnostics, or something like that, it's getting really complicated. You have to do a full assay validation and everything on top of that. If you are doing very small scale testing that is not used, for example, for clinical decision making in a clinical trial, for example, it's less complicated. Really depends on what you want to do and what you want to achieve. The more you go into an area where you really do patient data analysis in a clinical decision-making process, the more strict the criteria for validation are. Our goal at the moment would be that we really go for something that is fit for purpose, at least to start with something, and then go into this, as Tom already outlined, into these discussions with regulatory authorities and figure out what would be a desired set of criteria that they would like to see us picking up. Because at the moment, if you talk to people, everybody has some ideas on it, but it's not like there is a defined set of this is what you definitely have to do if you want to go for the minimum level that you should have for a certain application. It's a little bit more in an unclear situation in many of these cases. So you have to check and probably align with these authorities. So it really depends. Okay, Tom, do you want to talk about the Slido results?
Okay, can you see the screen now?
Yes, we can see.
Apologies, we've tested this in Teams, but in Zoom it didn't work. So apologies for this. So if you want to still participate, you can participate with this QR code still. It will be updated on the go. So we see that most of the people are working in clinical research and pharma, and there are academic institutes and hospital representative among us, which is super nice, diagnostic and basic.
Hang on, I don't think we can see the screen, at least I can't.
Okay.
I can.
Yeah, but you're probably also host, Bill. You have to change that.
You clicked on the link, Phil, because I can't see a screen share here.
Okay. So I'm going to stop my share and try to reshare again.
Can everyone see it now? I can see it.
No, I still can't see it.
You can see it if you click on the link that Ken put in the chat, that will take you to the slide deck where you can participate in the survey directly.
Okay, but there I can't see the results. Now it works.
Okay.
Okay, I just made you co-host, Tom. I don't know why it didn't work straight away. Sorry about that.
No worries. Thank you so much. Eventually, okay. So we see about half of the participants of the surveys are in clinical research. A lot of them are from pharma, doing clinical work, working in preclinic. We have also a lot of participants from academic institutes and hospitals, diagnostics and others, and some in basic research. At the moment, we do not have anyone from regulatory authorities. I hope we can, in the context of the special interest group, invite some in future to give a talk or participate. That would be absolutely great. Yeah. The next, are you using NF Core pipelines? So most of the participants already using NF Core pipelines. Some of them don't. That's great that Alex kind of introduced those pipelines. So you can see that a lot of participants are already involved, which is great. And we encourage people to look into this. The main interest is transcriptomics, closely followed by genomics. There's epigenetics and proteomics and metabolomics and other type of research ongoing. In this case, I think this would be supporting our suggestion to first develop a proof of concept with the most used NF Core pipeline. That would be RNA-seq, for example. The pipelines are mostly non-validated or internally validated. We do not have any participants who said that they are externally validated by a regulatory authorities. They use externally validated pipelines. So I hope we can work on this. And this is absolutely fantastic platform to discuss this. Are you audited? A third, almost a bit more than a third, said not yet. So there is an audit incoming. Also 30% are not audited, 20% are audited, and a couple of people don't know. Are you working on qualified computer systems? We do have yes, partially, and no, and don't know. That is a nice overview. And are you submitting results of bioinformatic pipelines to authorities? Half of them don't. Almost a third said yes, partially, and 10% says yes. For internal decision making, so pipelines are mostly used and almost 100% used for internal decision making, but also supportive for drug approval, and about 8% is said that the submission is used for drug approval. Where supportive for drug approval and so for the submission is a bit of difference to be discussed. Any additional info? Here said pipelines are not validated, but to be validated on fit for purpose level. In rare cases, analyses on exploratory biomarkers have been submitted as supportive information to the authorities. Working for HASCL, regulatory development and maintenance of INF core pipelines, but no current work explicit with regulatory frameworks. And results of pipelines are used for clinical diagnostics and again, clinical diagnostics. And we have ISO for some. That was the overview of the survey. Thank you very much for participating. I think this is a nice discussion point. We do have, especially with the ISO, we do have some comments in the Slack channel already, because there are different standards and there are different standards for different purposes. Therefore, I would like to hand back to the hosts and Alex et al., Phil et al. And thank you so much.
Thank you, Tom. We have two questions already on Zoom as well that I may read out now and then try to answer already in time. One was from John. This may be what we'll get to today, but I'm curious how it's even possible to lock down pipelines sufficiently to satisfy regulatory authorities while maintaining low barriers for community contributions to workflows. In other words, will we need a locked down regulatory branch of NF core RNA-seq validated and released infrequently? It's a very good point, honestly speaking, John. I also had thought about this already in the past. How do we envision that to work? I think in the end, it's up for discussion. I think we need to come up with exactly these type of discussions, exactly these type of guidelines, and also talk to authorities how they would envision this, while still keeping some of this community alive and able to contribute actively and also in a short amount of time. And in many cases, I think it's also possible that people can really contribute without really causing any trouble on the regulatory branch, let's say. The question is also how do we set these standards? How do we communicate them? Could be some label, for example, that you can then add to a GitHub repository that has to fulfill certain standards, so that you have to tick off certain things that we already have. Maybe these type of things are something that we really would like to discuss and then come up with a good solution that works for the community, but also for authorities in the end. I think that's the main purpose of this. And the second question, Olivier had one. The first issue may be the validation data set. Do you plan to use real data, big regulatory concern, or synthesized data? Because validation for diagnostics at least should be done on the production side. Again, I think it's going exactly the same direction. Yes, these are exactly the type of questions that we should tackle and that we should try to come up with solutions. Because at least our understanding and what I've seen so far, also reading up on the topic myself a lot in the last couple of months, it's not like there's a clear path forward. I fully agree with what you say, but we need to come up with a livable situation that is okay for a lot of use cases, and then discuss, especially with authorities in these settings, what could be a solution that works in the future. Because, for example, if you look at uptake of biomarker data in submissions for clinical trials, this is not so much done at the moment. It's something that is kicking in more and more now and over time. But it's a big question on how and which standards you should apply to make sure that everything is in order. And these type of questions, like how do you validate this, are exactly the ones that we should tackle in the community, I think, as well. Because then everybody can chime in, everybody is from day one basically involved or can get involved, authorities are involved. We come up with a good strategy on how to tackle that, and then hopefully this is helping everybody in the field to move forward.
Just quickly, I think my feeling on this is that there will probably never be a one-size-fits-all solution for every possible group. So we should be realistic about that. But that doesn't mean that we can't kind of collaborate, and every group that has to do this anyway kind of shares as much as they can so that we can learn from one another, share resources. And so maybe there will end up being, 6 different validation data sets which are available for RNA-seq or something. The more we can do to kind of prepare the ground for everybody, the better. But
Yes.
as Alex says, I think this is very much something we just have to kind of figure out as we go.
Exactly, but if we already prepare everything for that, and then people can, for example, run these pipelines in a defined environment where they usually run their production data, for example, with some assays that they run in-house, but they know already the in silico part is already set in stone, follows certain standards, guidelines, and everything, but you have to run it on your own production site, for example, then that would already help a lot, I think, many people.
Tom, you had your hand up, or maybe?
Yeah. So I wanted to comment on the version. I think for proof of concept, definitely we should freeze a certain version, or this was the suggestion, because otherwise it wouldn't just not be possible to do this properly. And eventually one can envision that a community effort of updating an already validated pipeline in future and some sort of regular in I don't know, yearly, bi-yearly, or whatever time frame could be, for example, envisioned. But in this case, I think there probably one of the ways to go would be to have certain versions of NF Core pipelines like RNA-seq saying this is the version which was then tested and validated.
There's other questions as well. Yeah, I think regarding versioning of pipelines, actually, Anders, I think that's exactly the type of thing that we also need to discuss within the special interest group. Also propose maybe, I mean, I think it's up to us in the end to actually come up with good guidelines, come up with ideas on how we could either influence how NF Core does this already, or whether we can come up with an additional set of requirements that we would feel like need to be done to actually prepare for these type of more regulated, validated pipelines in the future. If you come up with good ideas and good standards, and for example, you feel like the current SENVA doesn't really capture what it means to change a bioinformatics pipeline, then that's something that we should bring up, first of all, with the special interest group, but then also maybe with the wider community, and try to actually answer there. Then Susanna also had a question, which is validation is very connected with the specific intended use, intended purpose. This is absolutely true. We need to also outline what could be something that we can really achieve. I mean, Phil also brought it up that it might be unrealistic to fulfill everybody's needs and requirements, but we would maybe have to tackle at least prepare everything in a way that we can do as much as we can do in a generalized setting, and then propose, for example, if you really want to use this pipeline now within your environment, within your institution for such a purpose, you also have to do this and this and this and this, for example. But if you can prepare the stage already so that this is actually easier for everybody, I think that would already be quite a leap forward, because at the moment I'm not aware that this is happening in open source pipeline communities per se at the moment. Yeah, that's the same for Jose's.
Maybe Ken, you had your hand up for a while there.
Yes, sorry, I don't see everything.
Sure. Just one thing that I wanted to comment on to sort of drive home even more the importance of this effort, in my view, is the FDA recently finalized a new rule regarding the regulation of laboratory developed tests in the United States that will cause a lot more tests to be regulated as medical devices. And that greatly increases the threshold that organizations across the United States will need to meet for validating that their pipelines are hitting the thresholds in terms of accuracy and reliability that Tom described so well earlier. Pooling a lot of these resources around meeting these regulatory frameworks sounds like exceptionally valuable to me from my perspective.
Great. And then Harshal, you had your hand up there as well.
Yeah, thanks, Phil. So can I just say that I think this is going to be super, super useful, this whole special interest group. This topic has been going around for a very long time, and just the ability to bring people together to attempt to solve this more systematically, I think is going to be incredibly powerful and give us all the onus to actually get something done here as well to some extent. So through previous discussions, I think what is still quite unclear, and I think Tom and Alex have alluded to it in their slides, is what is actually needed for us on the behalf of the regulatory authority here to say that something is validated. And I think there are various definitions and ways that you can go about doing this, but it'd be interesting to know, first off, what those guidelines and what those targets mean in reality for pipelines. And then on the pipeline front, we've spoken and brainstormed ideas in the past about how potentially we could automate a ton of this. And so I guess it then becomes a question of how much of this can we automate, knowing what we need to fulfill for these authorities. How much of that can we actually automate to get to a point where maybe pre-release or after release, we run a bunch of tests in a production environment on AWS or somewhere like that automatically on a data set that's already been validated, generate some results that will also allow us to have some sort of diff compared to what a benchmark result is. And then what proportion of that would then need to be run manually? So if the results do change, how does the documentation change? How do we manage the change management process? But I think we can get quite far with automation if we know what we need to tackle and how we need to tackle it. And then there may need to be tweaks that we need to perform to actually get the documentation and other stuff sorted out. But yeah, I think it'll be super cool to do that. So knowing what those guidelines are and having everyone on this call as a unified brain to push this effort forward is amazing. So yeah, thank you for joining and being on this call as well.
Vivek also had a question.
Yes, I mean, sorry, part of it is answered already and raised. I mean, I just want to bring to the point, this is very helpful so I'm representing from Novo Nordisk, and we have been involved in trials where we are kind of working with different types of omics, either as a primary and secondary other than exploratory endpoints, and we are kind of using NF core pipelines right now. And we're also trying to understand, and we're joining different workshops where FDA is also involved to, like, how do you do a regulatory submission when there is for supporting a drug? So I think this is very helpful because we also, there is no clear precedence. And I think Ken has also brought about this LDT part. Some of these omics are not a part of LDT. And that's where the burden becomes more high. How do we define that concept and the process, right? So I think if we as a community can come up with certain standards, I don't know what to do with it, it's ISO validated or what, and also work with our respective QMS or audit teams, how that can be shaped from the pharma side as well as the institutional side for any kind of submission. I think that will go in a long way from the academic side and as well as the pharma side. So I really appreciate this initiative, and I think we would be very much happy to kind of join in whatever way we can, and also sometimes bring some of our regulatory folks from the industry side as well, if some of these are needed in terms of shaping of the initial documentation or the guidelines. Thanks.
Should we take a couple off for Q&A, Alex, before we go on to Harshal and Tom?
Can do that, yeah. I think Vivek was already there, so maybe that one was answered. Famke had another one there. The regulations might differ between countries. How do we handle variation there? Would it make sense to collect different points and report the status of our pipelines? Sort of like linting if the requirements can be checked automatically. Yeah, absolutely. I think this is exactly what also the intent behind this special interest group would be. I mean, we all have different obligations to follow up. So we're just outlining like FDA and EMA as the most prominent examples, but there could be other requirements that you have to fulfill. There is certainly probably also some overlap, but we need to figure out what's the overlap and what's the differences maybe also, and what specific type of requirements would be relevant for us. And at first, collecting experiences is actually something that Tom already had on the slide deck, and I think that's the first step we need to do. And if we then have a set of defined requirements that we need to follow up with, then we can try to challenge them and figure out how to solve them in terms of coming up with these guidelines. I think that's something we can definitely do and should be doing within the special interest group. Okay, Jose already had a couple of comments there. There are a lot of regulatory requirements for ISOs that happen around the current pipelines. For example, how to control for sample swaps or implement PC, the sample chain, to make sure that the samples we are sequencing belongs to the patient. Are you planning on covering this as well, or focus only on validation of the main pipeline with public-private dataset? Need much from SNP, sex control, coverage controls for clinical genes, the standard stuff. I think there were a couple of people like Christoph already said that checking sample identity should be based on another method of reference using primary sample tissue. How could this could be addressed in the pipeline? There are some methods to do that in the pipeline, yes, but I would also try to keep it low as well at the moment, because if you open this up, I mean, like a complete infrastructure topic, that's a completely not different topic. It's directly related to running these pipelines, but I think this is already complicated enough if we really come up with standards for pipelines. So if we also try to cover everything that comes before and after, that's going to be way too much to cover. And let's be realistic, we already need to figure out how to do the middle part, like the pipeline part. That's going to cost us a lot of effort as well already. I think maybe rather out of scope for now, without saying it's not something that cannot come up at some point in the future. But maybe let's be realistic about it. Although I'm well aware, and I mean, we are running analysis tools on validated systems, for example. So that's probably going in the same direction, that we guarantee certain things there, but the analysis system is actually fit for purpose for running these pipelines, for example. That's something that is probably out of scope at the moment for this topic. Okay. Then, yeah, another one, or maybe we should go to the next.
I was going to say, Tom's had his hand up for quite a while, so.
All right. Thanks. So I just want to comment that in the light of an internal audit we were talking to an auditor, and what we really realized was that NF Core has already an incredible high standard. And this standard is actually really helping with auditing, because one of the things is testing, documentation, and change management, for example. What the auditor says, there shouldn't be a competing interest that only one person is developing a pipeline and, for example, checks their own pull requests, etc., etc. In this case, NF Core has already a very, very high standard, which can be built on top of this. And I suppose that with different standards of different regulatory authorities, my feeling is that they are not competing, rather than they're building up on this. So you can be more stringent for one and more or less stringent for another, but it's never bad to be quite stringent. In this case, I wanted to ask the round for probably for experiences. Maybe you want to share your experiences with auditing bioinformatics pipelines, or with the regulatory authorities. Thank you.
Feel free to throw your hands up if you want to share any experiences while you're thinking about that. Matthias Zepper's had his hand up as well, so I'd like to.
Yes, hello. Thank you. But unfortunately, I can't share any experiences regarding our pipeline validation because I'm representing the National Genomics Infrastructure in Stockholm, and we do validate pipelines, but not for this purpose. But that's exactly the question that I wanted to ask. What kind of regulatory approval are you aiming for? Are you aiming for a medical device approval according to the MDR, or are you aiming for an in vitro diagnostic regulation, basically? That would be like, so basically MDR or IVDR. And the second question would be, if you are aiming for the RNA-seq pipeline, I think that's only half of the story because you would need the differential abundance as well, right?
Yeah, I think what we discussed for RNA-seq previously was we already do full-size tests when we release the pipeline, and that is based on some test data that was from a Michael Love paper because it just made sense to use at the time. And that will generate some account matrix. What we could do as part of the validation is essentially tag some automation on the end that runs differential abundance after that to generate some differential results and be able to then compare it maybe to a previous release. So you can start assessing what the differences are between, I don't know, the number of totally differentially expressed genes, or looking at PCA plots and really figuring out where we have the margin for error in the validation to try and inform what we then need to do to write the appropriate documentation or validation on top of that. But I think we can get quite far in actually just automating the running of the pipelines and then figure out how we justify the change.
I would mention there that I think, Matthias, you were sort of saying that we need to do the validation of the differential analysis expression pipeline, whereas Harsha, I think your answer was more about using that pipeline to do validation of RNA-seq. So maybe there's like a bit of a slight difference in between there, but
I think realistically, I mean, Matthias, to go back to your question, realistically, we have to start somewhere. And the initial idea was to start with one of these pipelines that is around for quite some time now, that already covers, I think, a lot of the requirements that any authority would put on them, like a lot of tests, documentation, proper usage, proper uptake by the community as well, because that was also some feedback we initially got from some of our internal auditing and quality team. That if you have a pipeline where a lot of people are involved in, the likelihood that this is actually not doing what you expect it to do is much lower than if you have an isolated pipeline with just 5 people who are around all the time and doing bug fixes, because the likelihood that some serious bug is detected is much, much higher to have in such a small pipeline than you have that in RNA-seq, for example, where I don't know how many GitHub stars it has now, but I would say probably hundreds, if not thousands of people are working actively with this pipeline. So the idea would be to come up with a proof of concept first, figure out what would be missing, figure out with the experiences that people have, figure out with authority involvement as well at some point, and getting feedback from them. What would you see as something that you would need to do for these type of analysis pipelines to cover, and then try how far do we actually get with RNA-seq for the beginning? And then, as you said, it will not be the full thing, obviously. I mean, this is just the RNA-seq pipeline. On top of that, we will at some point then also need to go for differential abundance, and potentially people are already interested in like the standard pipelines. I would also think about like Zarek and other ChIP-seq, ATAC-seq. There's tons of pipelines out there that are used in clinical applications, more in the exploratory world at the moment, but it could be potential next proof of concept candidates once we have done one. And I think if we start with one, figure out, also make our own experiences, maybe also go in a back and forth ping pong situation with authorities, what would you see as what we would need to do for this? Then that would help the entire field to move forward. And that's, I think, the vision that this is about. We're not saying this is going to work. This is definitely going to work in the sense that we will have better understanding, I hope, in the end, of what would be needed and necessary to make this a success in the future. But I think it's quite a good time now to do this and to start this also, because a lot of people have a shared interest there, and would definitely like to chime in and also work on this together. I think NF Core now has also quite a momentum, so I think that's helpful in this sense as well.
I very much agree. I just wanted to ask you, because you apparently already had some contact with the auditors. When you say like validating a pipeline, you're always validating a particular parameter set, because obviously RNA-seq can be run with different tools, or are you validating like all different possible combinations?
There's a set of parameters that is typically used. For example, for our internal pipelines, we have a set of defined parameters that we typically use for these type of things and analysis types. And the idea would be that we also kind of come up with this type of parameter set for RNA-seq. That's kind of the agreed, this is how you do it. I mean, Harshil had a lot of interaction when this was developed. And I remember a couple of years ago, with experts in the field, like Rob Patro, for example, gave a lot of input how you do transcriptome analysis, transcriptome counting. Then this could be something where you have a set of criteria and recommendations. If you run the pipeline like this, with this set of requirements, and fulfill all of the other steps that you need to do, then this is at least to some extent validated. We will probably not make it up to what you mentioned at the very beginning. Certain standards are really a little bit higher for certain applications, but that's exactly, we would like to make the first steps accessible to everybody and also make it easier to follow these, and then we'll see how far we get. But I think we really need to start with this proof of concept first and then move gradually towards this common goal. And if you do it for RNA-seq, that's the first pipeline, then you can also do it for different pipelines like differential abundance, SAREC, others. Or other people or subgroups of the community could even try to do that if they have a specific purpose, but we already have these guidelines set up and how you do these type of things, then everybody could do it basically, or at least a group of people could do it. And that's, I think, the hope that we are all aiming a bit for.
Yes, thank you very much.
Camille, you've had your hand up for a while there.
Thank you. Well, my comment was partially answered. For everyone, I'm lead Nexo developer and at Ardigen. There was a question from Tom regarding the experiences and comments. And comment from my end is that usually most of the time which we spend it during this kind of work when it goes to validation of the Nexo pipeline was the actual documentation. Which in many places is not the gold standard and not meets the requirements. And the next case was the test coverage. So basically, it means that every set of the parameters which is used in the clinical application have to be validated. And this was kind of partially answered by Alexander, that there are some sets of the parameters which have to be covered during such a test suite, and that's something what is worth to be aware. And yeah, it really depends whom is validating the pipeline, and the standards are very, very wide. So it really depends where there would be what would be the starting point basically. But this effort will be definitely helpful. Thank you.
It's a question from Anders Lind in the Q&A, which I think is quite interesting, which is, has there been any discussions or anyone involved in work with cyber security, which is something we haven't really touched on here. Part of what they're considering is to implement more container scanning to find potential malicious code, or using third-party tools, which overuse of third-party tools within the pipelines, and whether we should kind of really inspect those tools and whether we should work towards removing abandonware or third-party tools with known problems. I'm curious to see if anyone else has thought about this, especially those of you working in pharmaceutical companies with open source NF core pipelines. I know that quite a lot of people are using mirrors of container registries and things, for example, is one thing that some people do, and doing custom builds or custom image scans. Something we've recently done is with secure containers. We're trying to help on that front. And one of the things that Secure Containers does using Wave is to run security scans on images. So we should hopefully soon have security scans on all images in NF Core if things go to plan. And also SBOM's software bill of material documents for every container is my hope. There's a bit of work to do before we get there, but that's one thing. Hopefully that'll be useful. I'd like to know if it is useful. Alex?
Maybe answering your question there directly, yes, it will be useful. And I think people are concerned about these type of things. What we do as well already, and may have to ditch that in favor of what you're proposing there and what you built there. There is Aqua security scanning for containers, for example, automatically done here within the company. So for example, we do scan the Docker containers coming from NF Core by an Aqua security scan. So if there's anything maliciously entering the system, that will automatically be flagged by IT already. So that's what I've also heard from other people who use public open source containers from other communities, for example, that they do it as kind of a risk management as well. But if this is coming via the NF Core container community nowadays, then maybe we don't have to do it that way anymore, or can just do it as a double check in the future. I'm not sure how others are doing this, but yeah, I think could envision this could be done as well, individually if people need to. But, yeah.
Anders, I don't know if there's anything you can comment on about what you're doing in clinical genomics to do with that.
Yeah, I mean, pretty much the same thing. I think in general, we've been a little bit not working with this so much in the hospital setting previously, but we're getting our eyes open to this more and more as it's more and more part of the IVDR part. But it's exactly it. And I think the biggest part is the easy part is to do the security scanning. But then the question is, how do you deal with what is actually flagged? And what are the policies for actually doing something about those things? Also, it's also very clear that there's a lot of quite old tools and abandonware. I think that's quite a scary interest point for someone could submit malicious code in that sense. So we're also trying to remove, the worst kind of PhDware that hasn't been dealt with in years and years.
Is there any way you're identifying those kind of tools, or just by kind of looking manually at the sources?
Yeah, pretty much that. So we're trying to set up some kind of policy of looking through the issues and seeing if there's been things reported by the community and trying to avoid things that are currently not at all developed or maintained.
I mean, Quai.io also has a kind of basic security check on the images. So if you go there on the biocontainer images, you see the bit security reports, but I'm also not sure how to act on it then.
I mean, we could be thinking about the base images, what is used, and kind of trying to at least keep them up to date. That's something we've discussed a lot, trying to set up base images for things that are as up to date as possible.
I was about to say exactly that. One thing about secure containers is if we have control of the base image and the builds from Macondo images, then we can in theory update those. We'll need to update the references to those because it will generate a new image if we update the base image. So we have to pin the new version in the pipeline. But that's something which we might actually be able to do something about now, which is nice.
Okay. I think at the moment, no new questions in the chat room. It's nothing new, no. So
may I ask around again? So if there are no new questions right now, so does anybody have contacts to the regulatory authorities who, or somebody already in mind, contacts who you would be willing to ask if they would give a talk here, or anyone you have in mind who would be very useful to invite? And the other question would be maybe also a call for, is there any, probably you want to comment of interest, so to pool resources to, for example, if you say yes, as a company would be quite happy to pool some resources to validate our proof of concept.
I mean, for the RNA-seq, we would definitely be interested to help a bit, but since we as an academic institution have probably different requirements and would also validate the pipeline, this is why I was asking before whether you are aiming for the IVDR or the MDR or something, because we just need to comply with a certain ISO certification that we currently have. So I think the requirements are a bit different. But the RNA-seq pipeline is definitely something we are also interested in getting more standardized. Because, for example, we also realize sometimes that also the accordance to the semantic versioning does not really fully work. So, for example, we are now updating from the version 3.3 to 3.8, and it's a breaking change with a sample sheet, and that should not be. That should be like a major version upgrade. So should have been 4.0 then instead of 3.8, for example. And things like that we then notice, but maybe not to the detail as you would need it.
That's an interesting question for anyone else who's going through this process. Do you use an internal versioning system for public repositories, or do you use the same versioning system as the shared community resource?
I can comment about how we're setting that up within GeneDx. We're still at the exploratory phase of figuring out how we can integrate Seric into our diagnostic pipelines. But we have the public version with a plus and then prepend like our private version. And our private version includes things such as our config profiles, which have a specific set of parameters that we are using or intend to use for production environments. And Comitizen actually makes it really easy to sort of maintain those two version numbers and bump the appropriate one with like a single command.
So you pull in changes from upstream basically from time
Yep.
to time,
So
make
we
sure
pull-
that you test it. Okay.
Yeah, we're still at the early stage of this, but we're pulling in changes from NF Core Seric when they do version updates, and so that will bump like the first version of our like version string, and then when we just continue iterating with like the second half of our version string as we make our own changes to that.
Makes a lot of sense.
So are you using like a monorepo tool, like dedicated, that pulls in several GitHub repos into a new monorepo, or is it kind of a home-built solution?
We just have a GitHub action that will sync changes from the NF Core branch of Seric to our own repository. It's a single repo, not a mono repo with all of our pipelines. So we have a dedicated repo for our fork, and we just use different branches. So master and dev, those are the official NF Core branches, and we keep those in sync. And then we merge changes from that into our private branch, which is Seric plus our changes.
Yeah, I was just thinking that these tools that have been developed for monorepo management might actually be quite suitable also for the kind of regulatory things, like take a pipeline and add some custom modifications to it, and maybe also retain these modifications for a future version, but also not go arbitrary jumps, but like pull in really dedicated tags or commits into your system. I think that might work. So I was wondering if anyone was already using those, because to me it seems like a good idea, but I haven't explored it yet. So your feedback was very interesting. Thank you.
Yeah, I think one thing that hasn't been mentioned yet that I think will definitely play a part in this is just how powerful of a tool NF-Test is. And specifically the fact that they have their sort of optimized tests run feature, which allows you to run tests only for the portions of the pipeline that have been changed. Kind of similar to what NF Core pipelines currently do with sort of like the NF-Test detect changes and the PyTest detect changes workflows. And so having those sort of like changes where you detect we've changed this module, which means we need to run tests for this module and also all of the sub workflows and the pipeline as a whole that depend on that module can keep the GitHub actions quick for merging changes into main, and then perhaps on merge into main, you can have like a full regulatory like quality set of tests that will run end to end. So that I think that's kind of one part that will definitely make this journey easier.
I'm curious, Ken, you said also you're making some modifications that you apply onto your branches. What kinds of modifications are they?
We try to be very light and only add things that like perhaps like are going to be sort of low code injections, like basically adding like a single line that's like include config and then like our set of config profiles. I'm still working on getting a policy for open source contributions for GeneDx. So we're going to hopefully be able to contribute some of the public tools that we're pulling in back to the open source community. But we do also have some internally developed tools that we'd like to be able to attach to the pipeline, and those are things that we wouldn't be able to share back. And so ideally, at least in my vision, we would share as much as possible with the open source community, and then perhaps keep back the set of like config profiles for what we use for production settings, and then perhaps an additional set of NF test cases that rely on our internal data sets. Because those are also things that we would not be able to share, not just due to like competitive reasons, but also because of patient privacy.
Yeah, makes sense. It's interesting to think about that on the tooling side as well. I mean, configs, one thing, it's not always easy, but it should hopefully be possible to usually include configs without editing a pipeline, but there's definitely a convenience factor. In terms of adding additional analysis steps onto the end, one of the things we're talking a lot about these days is kind of chaining pipelines. So what immediately springs to mind is whether you could have a system where you have you pull in the SAREC pipeline and then add on your stuff afterwards, so then you don't have to modify SAREC itself or various other things. So it's kind of, all of that's pretty early stage, but it's nice to think about it.
On the NF test front, RNA-seq's pretty much primed for a big release now, where we've added NF test to all of the components in the pipeline, modules, sub-workflows, workflows. And there should be a release coming out pretty soon. We're just waiting on some external fixes actually to get that release out. But yeah, I mean, an NF test is going to be awesome for sort of the fine grain type of testing. I think one thing that we haven't really talked about in much detail either is test data, and how can we get our hands on test data that is validated in a clinical environment potentially. For whole genome, that might be for variant calling type of data, it might be a set of variants, a truth data set with recall sensitivity, that sort of thing is probably what you'd validate. For RNA-seq, as we talked about briefly before, it might be a set of differentially expressed genes. That has tended to be quite a big bottleneck in terms of how you move forward with this on the community front, because these data sets also tend to be proprietary and are used internally to satisfy clinical authorities, but aren't necessarily available in the public domain. So yeah, that's a big open question, I think, for me as well.
There's a comment in the chat saying that we should remember that validation is more than just testing. From Marcel, I think, yeah, I mean, I guess that's referring to the fact that documentation might well need updates. Don't know if that's something you'd like to comment on, or anyone else.
Yeah, so it's my question. I'm Marcel, also from Boehringer Ingelheim, CSV auditor. And in the discussion, the word testing is coming up multiple times now. And I think that the validation, or one integral part of validation, is testing, of course, to verify that the computer system is doing what it is expected to do. But validation is fitness for intended use. So we need something from the business process defining what the system is planned to do, and then from there go to testing to demonstrate that it is fit for intended use. Besides that, we also need some, from an auditing perspective, I would say we are not able to check everything. What is important is trust. Trust in what is going on, how things are developed, the quality of code. And that is not something that you can demonstrate with test coverage and some buttons in the repro. Yes, we have 100% test coverage. That is coming from other areas, from the organizational part. And I think that's one important topic that hasn't been mentioned so far. Just wanted to outline that it might be important for moving forward.
And just with some hands popping up straight away, but just out of curiosity, I mean, how do you usually kind of inspect that kind of thing? Is that is it very specific to different sites, do you think, or how generalizable is it? And B, what kinds of things do you do to check on those points?
To be completely honest and transparent, that this construction with NF Core, this single repros with pipelines that are developed by multiple users and used somewhere, that is something that might not fit into our traditional auditing concepts. So it's not one thing on the user or developer side to do some things to prepare for an inspection or an audit, but it's also on the auditing side that we need to adapt our concepts. How can we deal with that? Is that a supplier, or do we treat them as a supplier or as a category 5 system? There are many open questions that on the other side have to be clarified as well.
Thanks. Alex, I think you were first.
Yeah, going in the same direction as what Marcel just mentioned. I mean, I fully agree that there's a couple of questions completely open at the moment, and I think that's for everybody who's participating here, both auditors as well as people doing development, as well as people who are really using pipelines. And I think part of, and maybe that wasn't mentioned as much in detail as it could have been mentioned, I mean, documentation and putting up things like kind of checklists, what you need to do. I mean, we have them in NF Core already. We have a lot of checklists, what you need to do if you want to make a release, for example, what you need to do, what you need to follow as in terms of guidance. There's certain requirements if you want to do a release. So for example, multiple people have to review. How many of these people have to do it? Who has to review in the end? There's a lot of these topics at the moment already there for NF Core, but I think we need to maybe also make sure that these are a little bit more streamlined or put out in the open, so that people who are not permanently working within NF Core, who are not developing NF Core pipelines, can see them at a glance, basically. So whenever they go to the NF Core page, basically finding documentation on these kind of more process, these topics would be helpful for an auditor, for example, to judge quality of such pipelines, because they will immediately see, without having to look a lot around, these are the things that all NF Core pipelines, or at least the NF Core pipelines who are a little bit more mature nowadays, follow and adhere to. And also like log files, for example. I mean, a lot of us know that implicitly when you're working with NF Core pipelines with the automated testing, a release, for example, automatically triggers certain test cases, large-scale test cases, that the documentation is already updated, also coming from a schema. These type of things are known to developers, but I think are less exposed to people who are just users or even looking at pipelines from an outside perspective, like an auditor. And I think that's something that Marcel maybe also meant with this, that we need to make sure that this is also known to people, that it's accessible to people, that people can check, okay, this pipeline release matches exactly the documentation, matches these type of parameter sets that you can choose from, so that people actually get the full picture of it and not just like a small subset of what's available. I think that's also part of the story that would help facilitate also people to gain trust in these pipelines.
I think that the documentation point is a really important one. The lazy side of me is basically telling me that we should try and automate as much of that as possible as well by having good templating mechanisms that sort of attempt to at least fill in the bits that are boring and you don't need to do over and over again. I realize that we'll almost certainly need some sort of manual version of what that documentation looks like. But I guess without going through the process and knowing exactly what we need and what would get to a minimal viable solution to satisfy authorities, it's difficult to know what we can and can't automate right now. But for me personally, I think that should be one of the biggest goals that we get out of this and hopefully translate to other pipelines is how much of this can we actually template and use in other pipelines straight out of the bat to keep things moving and to make it easier when we transition to other pipelines that we want to do a similar amount of work on.
So to probably discuss this a bit more with Marcel's comment, and thank you, Marcel, for this. I'm not sure how deep the knowledge is of everybody here in the chat and in the call. There are GAMP categories, the good automated manufacturing practices, and this GAMP categories is 1, 3, 4, 5. And basically, as far as I understood this, you categorize software into these categories, where 5 would be, for example, custom or bespoke software, and 3 would be non-configurable software. And depending on the categories, there are different standards which are needed for those to be audited. And I suppose the problem what Marcel is kind of describing is that from the auditor side, it's not really known where does a pipeline fall of which can contain different, of course, different bits and parts of software. As well as some sort of customized code. Every time it's going into customized codes, there needs to be a code review, for example, and that was what I referred to, that NF Core, NF Core has already quite rigorous framework for this, that there have to be code reviews, for example. Just to add this as a comment for this GAMP categories.
Matthias?
Yes, so I have another remark along this line, kind of what I perceive personally as the biggest hurdle or obstacle within NF Core regarding maybe achieving regulatory compliance of the pipelines would be we need a better bug tracking. I think that's what I perceive as very insufficient at the moment, because people just come up on the Slack and report something is not working, and then people are looking into it or maybe are making a GitHub issue. But we, for example, don't have a stringent keeping track of like known issues. So we don't actually bother to check whether an older version of the pipeline might be also affected by this bug. In particular, when it's discovered like in a module, of course, it's also relevant, like there might be multiple pipelines affected. So this is an issue, but also when it's just about the pipeline itself, then is that, because obviously there's no backporting happening. So it's always like, yeah, the latest NF Core version has the bug fix, but we don't bother to update like a previous release of the pipeline or something, even when it's a very crucial bug. And we might need a system that kind of makes it very obvious and also gives a good overview of which are the current bugs that are open. How are these bugs rated? Is it just like a small inconvenience, or is it a really crucial issue, like that the parameter is ignored even though you provide it to the pipeline or something? And then maybe it might be even mandatory or relevant that we kind of retract a pipeline, so that like when you say open up the RNA-seq pipeline 3.10, then it tells you like, oh, maybe you shouldn't be using this pipeline at all anymore because it has severe issues, or not, if it's just like, yeah, there are small things, but actually this pipeline is still fit for the purpose. I think that would be something from NF Core side that would be really useful to have.
Can we do something very simple to start off with, such as just we have issue labels already called bug, where you could have like, we could introduce different levels, just say have bug/1, bug/2, bug/3 or something to indicate severity of bug. And then when there's a release changelog, we could kind of highlight the ones which are high severity.
But this rating, I mean, who would be responsible to do this rating? Would it be the responsible pipeline maintainers, or would it be like a regulatory committee or something like?
Something I'm kind of not anxious about, but I'm keen to preserve is the autonomy and the kind of not tie ourselves up with too much red tape in the NF Core community as a whole, in order to so I would not be particularly keen on having kind of dedicated bodies that screen bug reports and stuff. So I would vouch for having people, either the people who submit the bug, or better still, the developers who fix the bugs to mark them, and then we can write up criteria for like how are these defined, like, you know, does it affect the data, or is it just like was it kind of a mild inconvenience in how something happened, or would it run without this in the past? So, you know, could it potentially affect people's existing results? Kind of stuff like that we could kind of document. But again, open question is more of a question for the people who need this rather than me.
Okay, maybe in the interest of time as well, we need to kind of come up to a wrap up now, more or less, quite soon. So 2 points we still had open at the moment was, since this was the kickoff, and I really appreciate how many people really contributed here already actively, either by asking questions, saying what they are already doing, what they're trying to do. Also different aspects and different perspectives were brought on the table. I think that's quite cool to have that for such a kickoff session, and can't thank you enough to actually for doing that. 2 points that I had on my list here, what we should maybe also briefly discuss or either delegate to the Slack channel in the future. Meeting schedule, we would like to continue with this, obviously, since we now kickstarted it, we would like to continue as well. Maybe something around once per month is something that we envisioned at some point, where we can quickly catch up. Also maybe invite certain people from the field who are experienced on certain aspects of what we briefly touched today. So, for example, it could be something where we invite somebody from FDA about the biocompute project, for example. That's an idea that was already circulated. We could have people who already have experience with ingesting NF Core pipelines within the clinical setting, how they do it, if they can talk about it, if they can share some of the findings, what they identified. These type of topics could be potential topics for talks. We can also try to arrange them within the NF Core bite-size talk series, basically, or keep it within the regulatory SIG. I'm actually open for both ideas. And then I would also maybe think about that we send around a small poly or something like that, so that people can also vote for the next meeting slot, because otherwise with so many people, I think it's going to be impossible to find a meeting slot that works for everybody. What are people's thoughts on that? Everybody happy with that? Otherwise, we will share that via the standard Slack channel and also maybe on LinkedIn, since there are a couple of people who joined from LinkedIn.
I think it'd be nice to put some of these kind of open questions and things onto Slack, so that people can respond async, and also obviously there's plenty of people who can't be here live. So I think it'd be good to follow up with that, and also be very happy to continue live streaming, or at least, you know, recording these meetings if people are happy with that too.
Sounds good. That's fine. Then I'll take these points with me and set up a poll and everything, so that people can vote, and then we'll try to get everything on the regulatory Slack already, so that people can also chime in.
Something I'd love to see is if anyone's willing to give a talk on their usage of Nextflow. It doesn't have to be NF Core pipelines, but usage of Nextflow within their kind of company or institution. I mean, I know there's people in this meeting who are kind of working in clinical settings, people in pharmaceutical, in industry. There's quite a range of kind of different people here, all with similar sets of concerns. I think it'd be really interesting hearing people's experiences of what they've gone through already. If anyone's willing to give it doesn't have to be a long talk. So.
See, everybody said that he would be willing to explain their experience. That sounds good. Okay, I think with that we can wrap up basically. Anybody who has something which we didn't talk about yet, which I forgot, Tom, nothing? No? Good.
Sorry, did we come up with some action items in terms of, when are we gonna, in the next meeting, are we going to flesh out what the requirements will look like? What sort of steps we need to take to figure this out?
I think regarding the meeting schedule, we need to have a poly or something like that. Also, because not everybody was able to join in today, so that we need to also include those people. Then next point would be also to talk about some of the topics that we already have covered today. I will copy some of the chat messages that were posted by people. Also, the Q&A I think is somewhere available, so that we can also take the comments from there. And also the Slido that we sent in the beginning is something that we also have, so that we can also take out the final outputs from that, and then send this around via the regular Slack channel, for example, so that people can also chime in when they want to, because I think a couple of us are also spread across, so it's not so easy to have everybody today in here.
I'm just going to say quickly about the Slack channel. If you're struggling to find it, it might be because, remember, there are two Slack organizations. There's the Nextflow Slack and there's the NF Core Slack. So this is an NF Core initiative. It's an NF Core special interest group. So it's in the NF Core Slack. And then there's a channel called #regulatory. So that's one. There's links in the chat, and there's also links on the NF Core website. But hopefully that might help.
Yeah, and I think for action items, at least for the next meetings, would be definitely great to have like some sort of a compilation of different standards, and maybe if you can spec it out, the requirements for each regulation, and eventually then when expanding the list to a certain amount, we can go to regulatory authorities, say, is this what you need, what you want? And get feedback. That would be fantastic. So maybe we can do this also via Slack or other channels to kind of compile a list of regulations and requirements therefore.
Yeah, I was thinking we could put together some Google Docs to kind of collaborate on these things, or HackMD or Stashpad or whatever, but some kind of collaborative document to kind of make some notes and thoughts about regulations, about potential initial plans for things we could do and various other things, try and build them up. And then maybe when that's something we can have kind of short talks within this regulatory meetings, but also kind of have discussions of those working documents might be useful.
Okay.
Super cool to do an event, maybe, I don't know, around Barcelona summit or something like that, where we just have, I don't know, some time put aside to sit in a room and you're not allowed to leave, eat, drink, for a few hours and try and see what we can tackle in person. I think there's a good bunch of people on this call that might be able to push this forward a lot quicker in that sort of environment. Just a thought.
Quick show of hands. People who are interested in coming to Barcelona at the end of October for the Nextflow Summit, because I'm thinking we could do it as an NF Core hackathon group, for example, the first couple of days of the week. Or share the link.
like a couple of people are interested.
I'll change my own hand.
I mean, it'll be also really easy to organize, right? We could just piggy bank of existing stuff that we're doing there anyway.
Exactly.
Good. Thank you everyone for joining. And then hopefully see you very soon. I will make sure that I take off at least my action items, setting up like Poly or something like that. And we can also organize ourselves in the Slack channel and send out the updates for that. And then I think we'll take it from there. Good kickoff. Thank you, everybody. See you
Thanks.
soon.
Thanks. Bye.
Thank you, everyone.
Thank you.